All right, it looks like we've got some folks jumping on right now. We are at that time. Wanted to thank everybody to our Tuesday, June 23rd Rotary Zoom meeting. It's great to see everybody. We've got a very exciting program today. Just quick reminder, if you are visiting today or a visiting Rotarian, please click the chat button in the middle of your screen at the bottom. So we can recognize you today for the meeting. So please click on the chat and add that. In addition, a couple house cleaning items. If you could please turn your phone ringers off, that'd be great. If you have any announcements that you did not get to me, you can send me a private chat and I will make sure that I get that announcement out or have you do that announcement today. So again, if you're visiting Rotarian, please go down on the chat button and Wesley will help me coordinate those so we can recognize you at the meeting today. And with that said, I'm going to go ahead and turn it over to Joe for our song and pledge. Joe.
America, America, God shed His grace on thee. Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesties above the fruited plain. America, America, God shed His grace on thee, and crown thy good with brotherhood from sea to shining sea. Oh, beautiful for heroes proved in liberating strife, who more than self their country loved, and a mercy more than life. America, America, may God thy gold refine till all success be nobleness, and every gain
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
All right. Thank you for that. And moving forward, we'll jump right in with our invocation. Ian Fletcher.
Let us pray. O blessed hope that binds our heart together in love, lead us and guide us this day. Remember all the needs of our members, strengthen those that need strengthening, heal those that need healing, encourage those that need encouragement, love those that feel unloved. As we continue to cope with the new realities of life, let not fear consume us, but allow our faith to conquer our fears. Let thy loving kindness keep us. Remember all the families in our community that have lost their businesses and jobs. Provide all their needs. We thank you for the innovative ways you've helped our community operate during these unfamiliar times. Please continue to keep us and bless the work of our hands. Amen.
Amen. Thank you, Ian. All right, I'll jump right in. It looks like we just have, if I miss anybody, please again go to the chat button. We'd like to welcome you along with all our Rotarians today. We have a visiting Rotarian, Billy Atkins. from Community Hospital in Gainesville, visiting from Lake City Rotary Club. Billy, welcome. Quick announcement today, as a reminder, as we do each week, if someone misses the meeting, a fellow Rotarian, they can always go to info@rotarygainesville.org. Watch it on YouTube. It'll be posted after the meeting, and they can go right on there and get an attendance credit, which is always a plus, so you can go right on there. Currently, I don't have any further announcements, so we're going to turn the meeting over to President Chad. President Chad.
Hello, everybody. Good afternoon. I don't have any announcements or comments today, so I would like to introduce Melanie Shore to introduce today's program. Melanie, would you please do that for us?
I will, Chad. Thank you very much. Well, fellow Rotarians, it is my distinct pleasure today to wear several hats. One of them is, of course, that of Rotary. But secondarily, I was honored about 2 years ago to be asked to join the Board of Trustees of North Florida Regional Hospital. And in that regard, shortly after my joining, Eric Lawson came back to Gainesville to head up our hospital here. And when I say our, I wanted you to know why, because they have made me feel very much a part of the hospital in my role in the Board of Trustees. Very quickly and briefly, I want to tell you a little bit about Eric. He is the Chief Executive Officer of North Florida Regional. And today he's going to give us insight and perspective as to how the pandemic has affected hospitals and healthcare. Eric was here in Gainesville before, so he is not new by any means to our community. Prior to coming here, he was the division CFO for HCA in Brentwood, Tennessee. He has many, many years of HCA experience. He brings tremendous and outstanding leadership skills. We are very, very honored and lucky and blessed to have him in our community. And today, Eric's going to go ahead and tell you about who we are as a hospital, how we've responded to this pandemic, and how, most importantly, a safe environment has been the goal for both patients and staff. So without further ado, I'm going to turn the program over to Eric.
Thank you, Melanie, and thank you, Rotarians. I appreciate you taking some time today to allow me to tell you a little bit about North Florida, to tell you how we responded and how we're creating a safe environment. And so I'm going to go ahead and share my screen just briefly. So in all of our hospital, every time we start a meeting in the hospital, we start with a connect to purpose. The reason why we do that is healthcare is hard. Healthcare is hard physically, it's hard emotionally. And so in the hospital, it's important that we share our stories and remind ourselves why we do what we do. There are so many amazing stories that come through the hospital on a daily basis. And so I'd like to tell you a story today about the amazing Henry, as what our staff called it. And so, Joe, if it's okay, I'm going to turn it back over to you and let you run the video.
All I know is God just put angels in my life that took care of me. That's all. Seriously, it's a miracle that I'm still here.
Now, this morning alone, getting out of bed with me, walking, able to sit in a chair, able to eat, able to take medicine, able to drink, water and everything like that. It has just been unbelievable and outstanding. And it's just rewarding. It really is. I'm a pretty, I guess you could say, tough-minded guy. I don't cry a whole lot. I'm not super emotional with the job, but sometimes patients like him choke me up, and I have before. So it's really rewarding, and it just makes me happy and smile to see people like him. It's truly awesome.
They love working with people. It's not a show. It's real. They love what they do. A real guardian angel. I met him at North Florida Regional Hospital. They was here with me through the miracle. Guardian angels. That's what they is, that's what they will be, and That's just the bottom line.
Thanks, Joe. So Mr. Henry was our first COVID patient in the hospital, and he had a tough go. He was on a ventilator and he was prone in an ICU bed for several weeks. And when I say prone, he was in a special bed that rotates the patient upside down. So he was face down for several weeks as he recovered from the virus. But he's made a great recovery now and is doing well, and so it was just he was just such a survivor. So a little bit about who North Florida is. Many people think we are the place that you delivered your baby or that you were born, and that is true. We are your hometown hospital. Last year, North Florida delivered more than 3,300 babies here at the hospital. But we're way more than just your hometown hospital. We are a tertiary medical center. We offer comprehensive cardiovascular services. We offer a comprehensive stroke program. Last year, we treated more than 1,500 stroke patients, and we provide numerous cancer care services here at the hospital. We also are a part of North Florida, part of HCA Healthcare. And I'll tell you a little bit about that in just a few minutes. But as a part of North Florida Regional, we participate in many clinical trials. We have a graduate medical education program. 2 weeks ago, we graduated more than 40 physicians from the program to start their career, many of whom are staying here in the community, which is one of our primary goals. And then finally, as a part of HCA, we are influencing healthcare across the United States. And I'll give you a few examples of that in just a minute. Most people don't know we're the largest taxpayer in the community. Last year, North Florida Regional paid more than $7 million in local taxes. Those tax dollars go to fund our local school systems primarily. And then finally, we are a mission-driven hospital. We've had the same mission at the hospital for more than 50 years. Our mission states, above all else, we're committed to the care and improvement of human life. And as we've gone through this crisis, it's been a great an opportunity for us to truly step up and show how we live our mission. And again, I will share some stories with you as we go forward. As being a part of HCA, many people don't know who HCA is. HCA is the largest hospital company in the United States. We have more than 270,000 colleagues, more than 94,000 nurses, and more than 38,000 active physicians. We have hospitals in 21 states, as well as hospitals in London as well. Last year, we provided more than 31 million patient encounters, more than 8 million emergency room visits, and we delivered more than 224,000 babies. And so what's good about that? So HCA has used its size and scope to actually influence healthcare in the United States. 5% of all hospital services in the United States are provided in an HCA hospital. In the state of Florida, 1 out of every 4 patients is in an HCA hospital. And so what HCA has done is they've leveraged the size and scope in our data collection and our healthcare records to actually improve healthcare. Through a study that HCA completed several years ago, we discovered that elective deliveries prior to 39 weeks greatly increased the risk to babies and increased their risk to being admitted into a neonatal intensive care unit. It is now a national standard that elective deliveries do not occur before 39 weeks. HCA has used its size and scope to improve how we provide care to our sepsis patients. Sepsis is the #1 mortality or killer in hospitals in the United States. It's a fast-moving infection that, if not identified quickly, can lead to death. HCA has developed systems that actually continuously monitor patients. for signs and symptoms that they could be becoming septic. And so by using our size and scope, we're actually improving healthcare. When I think about the COVID crisis, how has HCA been a part of providing care across the United States? In one significant way, HCA helped launch a dynamic ventilator reserve program and took a leadership role. HCA provided more than 1,000 ventilators, as well as leveraging our distribution systems and our supply chain to be able to reallocate and move ventilators from hotspots across the United States, whether it be New York or Seattle or California or Texas. And so HCA was a big part of developing that network and working with the federal government. During this crisis, HCA took a different approach to supporting our workforce and created a pandemic pay program where that any employee across our enterprise, if they had their hours cut, would receive 70% of their pay throughout that process. HCA was out front in working with the CDC and staying in touch with the CDC and providing PPE to our employees. HCA's executive leadership also reduced their pay in an effort to protect our frontline staff. HCA's CEO actually donated his salary to the HCA Hope Fund, which provides additional support for those in times of need. So that's a little bit about HCA. What have we done here locally during the crisis? For our patients, we limited our visitation to reduce the exposure in the hospital to our patients as well as to our healthcare workers. We developed dedicated areas for patients who are under investigation for COVID or who have been positively diagnosed with a COVID disease, with a COVID virus. We also quickly developed telemedicine capabilities, both through our physician practices so our patients could see their physicians, but also in the hospital. It's extremely difficult to be in the hospital, especially when you either don't have visitors or you have limited visitation. And so we quickly rolled out a virtual visitation program so that our patients could still visually communicate with their family members and friends. And so that's been a big help through this very difficult time. For our staff and physicians, we enacted a universal protection program, which I'll talk a little bit more about here in a minute. We also provided PPE and education to our staff. And again, I want to give you an example of what it means for our healthcare workers to don and doff, or take on and take off their personal protective equipment, and how that translates to the impact to our patients and our staff. I mentioned our pandemic pay and redeployment of staff. We also implemented a hoteling program so that if any of our healthcare workers had a family member at home that is at risk or susceptible, more susceptible, our employees could actually stay in a hotel of which the company would pay for, so that they did not put their family at a higher risk. During this crisis, the emotional impact on healthcare workers has been dramatic. And so we implemented a nurse care program that our healthcare workers can receive free counseling during this very stressful time. And then throughout the crisis, we've had daily and weekly town hall meetings and updates to our employees to keep them up to date on changing policies and procedures and what's happening here at the hospital. One of the things I want to touch on is the community response, and the community support has just been amazing. Our local law enforcement agencies from Alachua County, the Gainesville Police Department, as well as many other local police agencies came out and supported the hospital and actually did a police parade around the hospital. We had more than 100 police cars and emergency vehicles that surrounded the hospital one evening. Just to come out to show their support. Through this time, we've had more than 90 local companies and individuals contribute meals and food and other means of support to our healthcare staff. And I can tell you, it has been so well received and has really motivated and kept our staff working so diligently through this very difficult time. And we just really want to say thank you to everyone that has stepped up and played a part in helping us through this time. When the crisis hit, our company CEO, Sam Hazen, said we have two priorities. The first and foremost is we've got to protect our staff and our healthcare workers, and we have to protect our hospitals so that they can provide services to our community. During this period, and more than 270,000 employees, no one has been laid off or furloughed during the process. In fact, our company rolled out the pandemic pay process so that if someone did have their hours cut, they were still being compensated during that time. We also have worked to redeploy staff. So hospitals' volumes dropped dramatically when states started restricting elective surgeries, as well as people were actually afraid to come to the hospital. And so hospitals' volumes contracted pretty dramatically. So during this time, we've worked to redeploy our staff, whether we are using staff for temperature screeners at our access points, or we implemented a personal protective equipment depot where we are providing additional PPE 24 hours a day, 7 days a week to our staff. When the crisis hit, our company CEO said, above all else, we're committed to the care and improvement of human life. In most instances, this mission revolves around our patients, as it should, but it also revolves around our people. It revolves around our physicians, and it revolves around our communities. HCA is fundamentally people taking care of people in need. And it's been just a fantastic experience to see how our hospital and how our company has stepped up during this time. I mentioned a minute ago that people have been afraid to come to the hospital. And this has been a significant issue in our community. Across the nation, heart attack cases have dropped by 85% in presenting to the hospital. Our physicians have been very worried about heart attack and stroke victims staying at home rather than seeking care. I was talking to our medical director, Dr. Gillette, this morning, and he was giving me some examples of how in the past a patient would present with a routine appendix or a routine appendectomy. As a result, patients are staying home now. Now they're presenting much later in their crisis, and we're seeing way more ruptured appendices. During this period, we've also seen patients delaying their cancer screenings, and now we're seeing cancer presenting in more advanced stages in the hospital. So we have been very intentional about our efforts in working with local news media and local news outlets to really explain how the hospital is safe. And I'm gonna walk you through a few of those examples now. So we rolled out a few weeks ago our 4 pillars of enhanced safety, or our universal protection program. And the pillars represent, first, access control. When you come to the hospital, we have dedicated entrances for laboring mothers. We have a dedicated entrance for our surgical patients. And then through our emergency room, we have a dedicated entrance that splits patients who have respiratory symptoms versus patients who are presenting with other healthcare issues. And I'll touch on those in just a few minutes. We've also implemented safe distancing throughout the hospital. Most of our waiting rooms have been closed. The ones that are still open have social distanced seating and special communication processes so that our visitors are safe while they're here in the hospital. Our infection prevention processes have been enhanced so that anyone that comes to the hospital goes through a screening process. They are temperature checked as well as asked several questions. All patients, visitors, healthcare workers, and physicians, as well as vendors, are masked while they're here in the hospital. We have designated care paths in the hospital. One of the things that I've heard when I talk to people in the community or even our physicians is, I'm afraid that I'm going to be sitting right next to a patient who has COVID in the hospital, or that I'm going to come across a patient that is infectious. So as a result, we've dedicated and designed special tracks and wayfinding for our patients in the hospital. So if we have a patient that presents who is a potential COVID patient or is already a positive patient, those patients have special tracks in the hospital and dedicated areas in the hospital. When we transport a COVID positive patient in the hospital, we send a healthcare worker out in front to clear the hallways so that no one is exposed to that patient as they're transported through the hospital. And so we've taken extra measures to make sure that our hospital is a safe environment. You'll also see, if you come to the hospital, extra efforts around signage to help people understand where they can sanitize their hands and and the different routes that they need to take while they're here at the hospital. I wanted to touch on sanitization for just a minute. We have a dedicated sanitizing team working 24 hours a day, and all they do is wipe down elevators, any railings, any waiting areas, tables, chairs. They are sanitizing every surface that someone could possibly come into contact with. We've also stepped up what's called terminal cleaning. In any room where we have a surgery or we've had an infectious patient, we go through a terminal clean every time that room is turned over. And what that means is it's an intense disinfecting procedure that involves removing every detachable item, every light fixture, all the air ducts, all surfaces in that room are cleaned from top to bottom. And so it's a much more intensive cleaning than you would possibly expect as you come to the hospital. I also wanted to touch a little bit on personal protective equipment. We've seen a lot of pictures in the news about our healthcare workers and the number of hours that they spend in the hospital and gowning and degowning. And so I wanted to give you an idea of just what that's like. So the donning process is very specific. Our healthcare workers go through a very specific sequence of how they put their gown on, then how they put the mask on, their subsequent goggles, and then finally their gloves. On the flip side, when they leave a patient's room who's either under investigation or is positive, there's a specific process for how they remove their protective equipment before they go on to the next room. And so on average, the process to don and doff PPE as well as perform hand hygiene in between rooms takes about 3 minutes. And you think, well, 3 minutes doesn't sound like a lot. So let me give you an example of a nurse in a 12-hour shift. So our nurses in our dedicated areas, they work 12-hour shifts. On average, they are caring for 6 patients during that shift. They round and are in every patient's room at least 1 time an hour. More likely, they're in the rooms way more than once an hour. But if they just go in the room once an hour, that means they're going to go into 72 rooms during that time frame. That means over 72 times, they're going to don and doff their PPE. 3 minutes over 72 changes results in roughly 3.5 hours of a 12-hour shift just donning and doffing their personal protective equipment. It is a significant commitment to maintaining the safety for our patients as well as maintaining safety for our healthcare workers. And so this has been extremely stressful. And so one of the things that we have done as this now has become sort of routine in hospitals, COVID is not going away in the near future. And so what we're doing now is we're rotating our staff members that work in these dedicated units so that one shift they're in the dedicated pulmonary area and one shift they're in a regular medical surgical unit because of the stress that they undergo just in that whole process of donning and doffing their PPE. And so I just wanted to give you an example of just what our healthcare workers go through to maintain safety. I mentioned earlier that we have very specific tracks in the hospital. And so when a patient presents to the emergency room, we actually have 2 tracks. The first track, when you get asked a question at the very first point of screening, they ask you, are you here with a respiratory symptoms or are you here with some other type of an issue? If you present with respiratory symptoms, you go through what's called the orange track. If you're here with some other symptom, you go into what we would consider our clean areas. And so again, making sure that we separate our patients and provide those protective areas for our patients that don't have these types of issues. And so that sort of concludes my presentation. I want to end with we are a mission-driven hospital. And above all else, we are committed to the care and improvement of human life. And so I would like to just open it up to answer any questions. Maybe before I do that, let me give you just a few healthcare statistics for here at North Florida. Through yesterday, we have tested more than 5,700 patients. We've had 161 positive patients. Today, we have 9 COVID positive patients in the hospital, and we have 9 patients who are under investigation. I will tell you that census at the hospital has remained constant for the last 2 months. We have not yet seen the second wave. I've talked to my counterparts in South Florida, and they are starting to see a second wave of patients. Our sister facility in Lake City has also seen a second wave of patients as a result of the outbreak at the chicken farm there. So we here have not yet seen the second wave, but we are starting around Florida as well in Texas. We're starting to see our COVID census increase. So with that, I'm going to end the slideshow and just answer any questions that you might have.
Eric, thank you so much for speaking to our group today. You did an amazing job, and we're very grateful for your time and your expertise. The first question we have is from Rogers Bartley. Rogers asks, if your nurses are unionized, he says the HCA nurses in St. Petersburg, Florida and California are threatening to strike due to understaffing and a lack of PPE in their hospitals. And you're to be commended for your superior leadership at our hospital to avoid these issues locally.
Thank you. I will tell you, when the crisis first was announced, I am so proud to be a part of our company, because the first thing our CEO said was, we have to take care of our staff and we have to take care of our hospitals. Our first priority was to make sure that all of our staff had personal protective equipment. And like I said before, we have a dedicated team that provides PPE 24 hours a day. So we have actually a special number that any staff member can call if they are running low with PPE. One of the strengths of our company is our supply chain and our relationship with vendors. And so we, throughout this crisis, have really never run low on all the different types of masks and gloves and gowns. And so that's been a strength of our company, is the ability to reallocate and resources where there have been hotspots. And I think as our company has stepped up and rolled out a pandemic pay process, so that if someone did have their hours limited, they received additional compensation. I think that's been a big help for us as we've come through this crisis.
Thank you, Eric. Our next comment is from Scott Winsler, and he says he'd like to point out that with all of this going on, North Florida Regional Medical Center continued supporting local nonprofits. They were a Platinum Hammer sponsor at last month's Habitat virtual event. So thank you, Eric. Thank you for doing that.
Thank you.
I don't see any other questions or comments. Do we have more questions or comments? Okay, I guess not. Eric, thank you again for being here today, for speaking to our group. We are going to make a donation in your name and your honor to inoculate 100 children from the polio virus and hopefully eradicate that from the face of the earth. I have an update for everyone. This came in during the meeting today. Louis Calavoto had a major operation yesterday. He's responded well to chemo, and with the success of his operation, we're hopeful for him. Please keep him in your prayers. That was from Buddy Irby, so it looks like Louis has some hope, and that's great. Our program next week is our year-end wrap-up. So Matthew Brady will be presenting, as well as the incoming president. It will be my last meeting as president, and we'll have a slideshow of events we've done over the course of the Rotary year. So if you have any of those sorts of photos or videos or anything that you think might be noteworthy for that presentation, I'd love to see it. So if you'll send it to me or to Richard or Jason or any of us, we'll get it in the program for next week. I think we're all done. So thank you again, Eric. Our meeting is adjourned.